Let's start by defining what the Paleolithic diet is. The Paleolithic diet, also called the caveman diet, is modeled after the diet of prehistoric humans during the Paleolithic era around 2.5 million to about 10,000 years ago and gained popularity in the 1970s. One misconception about our ancestors is that they were strict carnivores. In fact, their diet was largely plant-based with some meats included as well. So this diet consists of fruit, veggies, nuts, seeds, lean meats, and fish. Strictness of the diet varies, and this can cause some confusion about which foods are considered paleo and which aren't. Some good rules of thumb when discerning which foods are paleo and which ones are not are: is this food highly processed, such as deli meats and pastas, and is this food largely produced by commercial farming, such as wheat, dairy, and legumes? The idea behind the paleo diet, called the discordance hypothesis, is that commercial farming and the foods that came with it changed the human diet at a pace that was too fast for the body to adapt, and is thought to be a factor in the rising rates of obesity, diabetes, and heart disease. According to Mayo Clinics, small trials have been performed that show short-term benefits of switching to the paleo diet, such as increased weight loss, but longer-term studies are still needed to fully understand the effects of the paleo diet on the modern human body long-term.
The Mayo Clinic wrote that the initial aim of the paleo diet as a whole is to return to a way of eating that resembles what the early humans ate. It is believed that the body and gastrointestinal system of the humans today has been genetically mismatched over time due to the modern diet that emerged with farming practices. Those who might choose to follow a paleo-regulated diet include people who are looking to lose weight, maintain their healthy weight, want help planning meals, or are looking to simplify what goes into their body. With the research that has been done on the paleo diet, professionals have come to the conclusion that there are several health benefits that individuals may not otherwise see if they regularly include whole grains, legumes, and dairy products. There are no proven long-term benefits, but it has been recognized that a diet mimicking the Paleolithic era includes greater weight loss, improved glucose tolerance, better control of hypertension, lower levels of triglycerides, and better appetite management. Although the previously mentioned benefits may sound appealing, there is one main ingredient lacking in the Paleolithic diet. The U.S. National Library of Medicine National Institutes of Health confirmed that calcium is imperative for human bone health and must be supplemented to prevent bone mineral loss. As college students, most of us know and can likely relate to the price and overall accessibility of the food we consume playing a large role in our diets. For example, not everyone has wild game available to them, which is a great source of lean protein. Two other items that can also increase the price are grass-fed meats and nuts. Although affordability is a huge factor, people should not be discouraged because there are ways to work around it. Something to keep in mind is that the terms organic or grass-fed are not required to be labeled on the package in order for the product to follow a paleo-based method of eating. For example, the protein source someone chooses to purchase does not have to be the more expensive grass-fed or organic option. It can simply be generic store-brand meat. Even with that exception though, it needs to be taken into consideration that the paleo diet still may not be feasible for everyone.
The paleo diet is relevant to nurses and other healthcare professionals because it is a popular diet. This means that you are likely to run into a patient currently on this diet or looking into this diet, and it is important to know what the diet consists of to best communicate with and educate your patient. According to an article by Christian Skepker in the Holistic Primary Care Journal, insulin resistance improves while on the paleo diet. She references a study where 70 obese participants follow either a paleo or low-fat diet for 2 years. The subjects went to group sessions with a registered dietitian and kept food records to keep track of what they ate, which is something we talked about earlier in the semester. After the 2 years were up, both groups showed similar levels of weight loss, especially in their abdominal area. But the subjects from the paleo group showed improved circulating fatty acid markers, achieved better metabolic markers, and showed an increase in insulin sensitivity. Also, compared to the low-fat group, the paleo group showed a 19% decrease in their saturated fatty acid intake, while increasing monounsaturated fatty acids by 47% and polyunsaturated fatty acids by 71%. In addition, they basically eliminated the refined and simple carbs that have been known to lead to being overweight and obese and to insulin resistance. This is important because as nurses and other healthcare professionals, you will run into patients that have insulin resistance or are on the verge of becoming insulin resistant, and it is important to know what types of diets and other holistic approaches may help these patients to naturally improve their health. Dr. Ann Carey Tobin expands on this idea further in an article she wrote for The Family Doctor, a journal of the New York State Academy of Family Physicians. Her article is titled The Paleo Diet as a Therapeutic Tool. She believes that good nutrition is essential for optimal health and well-being. Her professional engagements mainly consists of people wondering what type of diet will best support their health, assist in weight loss and management, get rid of chronic disease symptoms, or even get rid of chronic disease entirely. She says that her most frequently recommended diet is a paleo diet. It is a healthy diet that is well tolerated and can serve as a useful tool to improve your patient's health and combat illness. Dr. Tobin mentions that because of the prevalence of obesity in the United States, all healthcare professionals should be equipped to confidently navigate the world of healthy eating to help patients achieve and maintain a healthy body weight. Dr. Tobin mentions that patients in her practice who follow the paleo diet are satisfied after their meals, they lose weight without counting their calories. This diet has patients consuming more lean protein and satisfies hunger effectively, reduces their hunger in between meals, and could improve their insulin sensitivity. The paleo diet also results in added fiber from fruits and vegetables that will aid in feeling full after you eat them. The consumption of high-quality calories prevents the body from feeling like it's starving, so your body isn't sabotaging your weight loss by slowing down your metabolism. However, if your patient is trying to lose weight while on this diet but is failing to do so, it could be because they aren't filling their plate with nutrient-dense food options, but are instead over-consuming the nuts and other healthy fats. This information about chronic diseases and the paleo diet is helpful for nurses and other healthcare professionals because you will likely have patients that face developing insulin resistance, type 2, diabetes, and obesity. The paleo diet might be a really good first step to helping your patient lose weight, increase their insulin sensitivity, and become less likely to develop type 2 diabetes. In addition, this might be a diet to recommend to someone who is struggling with food intolerances such as lactose intolerance because this diet steers clear of all dairy products. It could even be the method that you use to diagnose their intolerance.
One of the diets that I've tried previously is the keto diet. So basically, like a general scope of it is I would eat 70% fat and 20% protein and then 10% carbs. So, but it was like good fat. So like what you would get from like nuts and stuff. And I guess mostly what I ate when I did that, it was like a lot of greens and just like a lot of meat. And the keto diet is supposed to be like maximize like energy. You're supposed to just like increase your metabolism. And when I did it, I did like it, but it was pretty hard. Like it was pretty strict because as soon as you like cheat or get out of ketosis, it kind of like ruins the whole thing. So you have to be like really good about it or like it won't even work. But when I was like on and like following my meal plan, It worked pretty well. Like, I lost weight and I felt pretty energized. It was just not super applicable to like eating normal everyday foods because it was so strict. But another diet that I've tried is just simply like calorie counting, and pretty simple. Like, I just took like the average calories that a person burns in a day based on like how old I am and like how active my day is, and then I tried to calculate like how many calories it'd take for me to lose weight, and I had it set to like I have like an amount for when I want to lose weight quickly or when I want to just like lose weight in general or maintain, and I would just follow those. And I'll do that periodically, like on and off, if I'm like more conscious at certain times, and that works extremely well, like as long as I stick to it. The only downside to that one is it could be like kind of difficult to count calories because sometimes it's hard to determine like portion sizes when you're just like eating at the stack or like at a restaurant. Like, you don't know exactly like how much sauce is on your sandwich or stuff like that, and so it's hard to be exact. And when you're not exact with calorie counting, it obviously won't be as beneficial.
I think it's important because it's our job to kind of be aware of like every aspect of our patients' lives, and so knowing what they're putting into their bodies could prevent like any complications from like their diet and the condition that they're in, including like medications and stuff like that. So
it is important for me as a future nurse to know what my patients are eating, because diet can be the first step in preventing certain conditions, and it is also one of the most effective tools in treating certain conditions as well.
for direct patient care, nurses and other healthcare providers need to assess each patient individually, and depending on their reason for seeking care, may need to have the patient tell them more about their diet and what their intake is in more detail. A few ways to get information about the patient's diet is to use one of the 5 types of screening. These include the quick approach, 24-hour recall, food frequency questionnaire, food record, and direct observation. While gathering food information through direct observation, that is when the nurse goes in and assesses the patient food intake and writes down their I's and O's. The nurse should be able to determine if the patient is responding good to the diet or if it is affecting them in a positive or negative way. Knowing what type of diet and food intake your patient is consuming is important to nurses because it helps us be aware of any allergies or medication and drug interactions. A paleo diet may seem like the perfect diet for everyone because the diet is rich in vegetables, fruits, and nuts, which are all healthy to eat. However, further research may be needed if the patient is missing key food groups such as an absence of whole grains, dairy, and legumes, which provide people with good sources of fiber, vitamins, and other nutrients. For example, further research may also be needed if a patient comes in and is underweight or malnourished while being on the diet. We would want to look more into this and make sure the diet is not causing the patient to experience these changes. If the diet is a factor, we would want to educate the patient to make sure that they are not cutting out key nutrients completely out of their food intake and that they may need nutrient supplements. As a healthcare provider, we can also refer our patients to a registered dietitian who can give the patient a more detailed look on what a balanced menu would look like while on the diet.
Hi Erin, my name is Mallory. I'm going to be your nurse today. What are some things that you're wanting to talk about?
So I've been on a bunch of diets lately. I'm trying to lose a little weight. I'm pre-diabetic, so I thought that might help with my insulin resistance. I've been on a lot of different diets and I'm just really frustrated. None of them seem to be working for me. I've been on keto, I've joined Weight Watchers, I've tried the Atkins diet, and at this point I'm just really frustrated that none of them are working for me. it's all getting really expensive switching to these new diets every few months. Like, I'm just really looking to find what would work for me.
Have you been interested or heard of any other ones that you might be interested in trying that I can help you with?
My friend did recommend that she started something called the caveman diet.
Okay, yeah. That's also called the paleo diet. Do you know anything about it?
Not a whole lot.
Okay, what are some questions that you have?
Well, I would like to know how strict it would be and how much of a commitment it would be, because it's getting a little frustrating when I would go to eat something and then realizing that it wasn't part of my diet.
Yeah.
And I heard that paleo can be really restrictive to like just meat and a couple veggies.
Okay, so initially, what the paleo diet is it does put restrictions on things like whole grains, legumes, and dairy products. Do you have any problems with those? So
I am lactose
breads,
intolerant,
meats. Okay.
but I do eat lots of pastas and breads.
Okay. So would those be things that you'd be willing to be flexible with and maybe ease out?
I would, but now I'm concerned about if I'm cutting those out, then how am I going to make myself feel full? And what am I supposed to eat? Because pastas takes up a huge part of my diet right now, just because I'm so busy and it's so easy to just make pasta and put on some jar sauce and call it a meal.
So those are some really good points. People who follow the paleo diet focus a lot on the wholeness of the foods and the raw factor that they provide. With paleo diets, you lose a lot of the processed foods, or all of the processed foods, which then cuts down on calories. So you can eat more vegetables for less than you can pasta. Does that make sense?
Okay.
So in terms of fullness, you could work in that aspect, but you also need to keep in mind that even though some things are being cut out, there are still several options that you can eat. When going to the store, it can be kind of intimidating to see that there's organic meats and grass-fed meats and organic vegetables, and they can cost so much more, but there's nothing in the paleo diet that requires the products that you eat to be organic or grass-fed or all natural. It can be simple, it can be generic, it can be frozen, but as long as it follows those lines, then it'll be perfect. Would you be interested in working together to create a menu and emphasizing the things that you can eat as opposed to the things that you cannot?
Yeah, I think that would be really helpful, because right now with all of these diets, I just get really overwhelmed.
For sure.
Because they all just tell me what I can't eat, but then I don't really know what I can eat, because it sounds like a lot of the foods that I'm not supposed to eat to be on this diet are a lot of the foods that are in my pantry at home right now. So that would be really helpful if we could make a menu together or something to help me get started.
Awesome. So I will grab some paper and we can do that together.
Awesome. Okay, so now that we've gone through with you guys what paleo is and what it's about, let's just go through what a typical day in paleo might look like for someone. So starting with breakfast, some good choices would be eggs, fresh fruit, bacon or ham, and some fresh orange juice. And you can still have your morning cup of coffee, just make sure that there's no cream or artificial sweeteners in it.
For lunch, it is important to avoid any deli meat or anything that would be processed, but whole cut meats like chicken breast or chicken thighs, a hamburger with no bun, or salads with olive oil and vinegar. And then on the salad you could put seeds, berries, different vegetables. And as I said before, olive oil would work, or avocado oil as well.
And then for dinner, you could have some stir-fried vegetables, some steak, some other burger, some sweet potatoes, or something like pork.
Some of the drinks you can have, Erin mentioned earlier that you can have black coffee as long as it's just plain black coffee. You can have tea as long as there's no additional sugar. Honey is okay, or just water works too.
And then for snacks, a good option to help you stay full would just be like a handful of nuts. So you could have like almonds or cashews, but on the paleo diet, peanuts actually don't fit the bill. And then some other things you could have would be some raw vegetables, like some cucumber slices or some carrots or some bell peppers. More fruit, like a little halo or a banana or an apple, just to help keep you going throughout the day. And jerky would be a good option if you guys are able to find jerky that has no soy or any added sugar.